Hi, this is Dr. Gaurish Kenkre. Over the next few minutes, I'm going to talk about aging and stroke. As we all know, as the medical science has advanced, the human life expectancy has increased. People who used to live for 50 to 60 years are now living around 70, 75 and more. With aging comes comorbidities. So aging population have to go through diabetes, blood pressure, which we call hypertension, increased cholesterol. All these things lead to increase in risk for heart problems as well as stroke or brain related problems. Now, what is stroke? Stroke in the older population usually happens because of clot, which alters the blood circulation to the brain tissues. As an outcome of this, the body or the human body gets paralyzed on one side. There can be a problem of speech, swallowing, droop in the face. You lose your control over your hand, fingers, your leg, balance issues. All this comes as an outcome of stroke. As a preventive measure, the older population needs to keep a check on their cholesterol levels, blood pressure, as well as diabetes. So a check or annual health checkup is something which is important. They should always have physical activity as a part of their routine because reduced physical activity leads to deconditioning. Keeping a check on your stress, keeping a check on your sleep, all these things are important to prevent the risk of cardiovascular events as well as brain related dysfunction. Despite preventive measures, there is still a chance of stroke happening. Now, how will you all know that the person is facing this issue? So you need to identify if they are having multiple falls, balance issue, speaking problem, sudden droop in face, unable to move the upper extremity, unable to move one side of their body. All these are signs of stroke. And urgent attention needs to be given because there is a window period or a golden period where the treatment needs to be started as soon as possible. Having stroke is not the end of the line. Patients should start rehabilitation as early as possible once they are medically stable. Ultramodern technologies like robotics, aquatics, virtual reality, along with conventional rehab programs help these patients reintegrate and achieve maximum level of function quickly. We have seen numerous old age stroke patients who have been bedridden, lost control over one side of their body, unable to speak, unable to swallow. With good neurological rehabilitation, with multidisciplinary team approach, robotics, virtual reality, aquatic therapy, and conventional rehab programs perform really well, good outcomes, able to reintegrate in their life quickly. I reiterate that stroke rehabilitation should start as early as possible post-stroke. However, we have also seen significant improvement in patients who have started their rehabilitation journey months or years later stroke. So my message to all the stroke patients would be, it is never late to begin, and for all the caregivers, never give up.